Hey, my name's Thomas. Today I'm going to be talking about senile dementia, better known as Alzheimer's disease. It is a progressive brain disorder that first destroys the affected person's memory and thinking skills, and towards the later stages of the disease can make the person unable to complete simple tasks like walking or eating. These symptoms are a result of complex brain changes that occur throughout the stages of Alzheimer's disease. On the left is a picture of a healthy brain, and on the right is a picture of a brain affected by a severe Alzheimer's. The beginning of this damage can begin a whole decade before memory and other cognitive problems appear, the cause being abnormal deposits of protein that end up forming amyloid plaques and neurofibrillary tangles, which in turn cause once healthy neurons to lose connections with other neurons and eventually die. Amyloid plaques come in many different molecular forms that collect between neurons. Neurofibrillary tangles are abnormal accumulations of the tau protein that collect inside neurons. Normally, tau binds to and stabilizes microtubules, which help guide nutrients and molecules from the cell body to the axon and dendrites of the neutrons. But in Alzheimer's disease, the abnormal chemical changes causes tau to bind to other tau instead of the microtubules, which results in tangles inside of the neuron to act to block the neuron's transport system. These are the two most well-known dysfunctions caused by Alzheimer's disease as of 2019. The most common group of people at risk of developing Alzheimer's disease are individuals over the age of 65. Every 5 years after the age of 65, the risk of Alzheimer's doubles, and after the age of 85, the risk of developing Alzheimer's reaches a whopping 33%. Not taking into account the other variables that could increase the risk as well. Speaking of those other variables, another big factor in developing Alzheimer's is in genetics, where if one of your family members has gotten the disease in the past, you are more likely to have the gene that they had that caused the disease to develop. Although these are the two main factors in getting Alzheimer's disease, there are potentially many others that scientists are trying to figure out today. The most tragic thing about Alzheimer's disease has to be how it mentally affects the affected person and their loved ones. Losing your memory is terrifying, especially when the memories you lose are the ones you vowed you would never forget, such as the little details about your significant other or knowing the surroundings of where you grew up. The early stages of Alzheimer's is often the hardest for the person affected, whereas the later stages are the hardest for their loved ones. In the early stages, the affected person can become very depressed or anxious, trying as hard as they can to remember things and getting extremely frustrated anytime they aren't able to. Luckily, this feeling starts to get less intense as the disease progresses, but that's when their loved ones are most affected, where their sons and daughters all of a sudden have to become caregivers and, in a lot of cases, their sons and daughters become strangers. 39% of today's Alzheimer's research funding is going towards exploring disease-related processes including brain inflammation, cellular transport mechanisms, genetics, and the production of beta amyloid. Unfortunately, finding a cure or remedy to Alzheimer's disease is no easy feat. David Gladenmaker, a neurologist at the University of Alabama, Birmingham, says one of the biggest issues in coming up with effective therapies for Alzheimer's disease is that we really don't know critical elements underlying the mechanism of the disease in most people with the illness. In general, Alzheimer's can be very hard to diagnose, since a single lab test, scan, or exam is never enough to do so. One big reason why it's so hard to treat Alzheimer's is that, as I mentioned before, the process of Alzheimer's disease can begin decades before the first symptoms emerge. Because of this, it is very easy for scientists to be too late in trying to treat the illness, since most of the cases involve treating the patients once their symptoms first emerge, rather than when the disease actually starts to manifest itself silently in the brain. In the future of Alzheimer's research, scientists look to focus on developing medications aimed at the beta amyloids, the chief component of plaques. This medicine would focus on blocking activity of the beta secretase enzyme, preventing the beta amyloid fragments from clumping into plaques, and using the antibodies against beta amyloid to clear it from the brain. Connected to this, new medicines are looking to attack the beta secretase, an enzyme that makes beta amyloids able to form. Thank you for watching. Please donate towards finding a cure on AFA's website.